What are gendered issues? Gendered issues are issues and problems affecting women's or men's lives as a result of society's perceived generalizations and beliefs about characteristics, capabilities, and behavior related to any gender. However, with much of our society, medical research or community design, for instance, being geared toward considering men first or as the norm, the result is that we consider issues that impact women as gender issues. Issues that impact men are just issues. Childcare, the gender wage gap, sexual harassment, menstrual products, the glass ceiling, maternity leave, lack of political representation, intimate partner violence, maternal health, beauty standards. When we think of gendered issues, the issues I just listed are some of what we think of. But what about economic recovery? What about something as specific as snowplowing? It is important to consider all of the ways in which issues are gendered and disproportionately impact groups that do not fit the mold of what British feminist, journalist, activist, and author Carolyn Criado Perez calls the default male in her book Invisible Women. Discussing gendered issues, gender equality, and ensuring gender equity in news coverage is not about being an activist journalist or taking a feminist approach. It is simply good journalism, as it aims to give everyone equitable representation in news coverage.
I would have to say, to anyone who thinks that they don't write about gender issues, my question would be, what do you write about then, like you said? Because everything is a gender issue, really, if you look at it that way. Not every story has to be about pay inequality for it to be a gender issue. There can be, you could look at anything through a gender-based lens. You could even look at, I don't know, how a store that's geared towards women costs more expensive than the one that's, air quotes, unisex.
We all view the world through the eyes that we're looking at in our own experiences, and that's what we bring to the table. And so everything that comes in, we perceive it through our lens and our experiences. You can't tell me that everybody has the same viewpoint on things, and especially if they haven't experienced it. I mean, how many times have we been in conversations where you're talking to a guy about something and it's, well, I don't think that's right. Well, right, because you didn't experience it. Health research is usually not, they don't include women in the research. So there's a reason why we don't really know what the symptoms of a heart attack are for a woman. And that's because research hasn't been done. So often we go to the doctor, we access healthcare, and we're being told information that isn't even relevant to our bodies. Unless you've experienced what a woman has experienced in terms of their health and the concerns that they have, nobody's going to understand that the same way. It really is important to ask the people who experience the things that are getting talked about in order to get a more fulsome discussion about it and all angles of a situation.
Everything is an Indigenous story. I shop at grocery stores. I buy gas. I have a car. I live in Niagara. Everything that happens that interacts with me in some way is an Indigenous story. And so if they're going to hire Indigenous journalists or, Indigenous, or journalists of color, let them tell the stories.
How would media coverage be different if journalists asked themselves and those they are interviewing some version of, what else is going on here? What might I be missing in telling this story because of my social location, experience, knowledge, or lack of experience or knowledge? Key takeaways. Consider broader social issues and contexts that impact and perpetuate all forms of gender-based violence and various gendered issues. Be aware of and consider the variety of perceptions, opinions, knowledge, and lived experiences that journalists bring to their work.